All right, if you're searching this, that means you probably had retainers at one point and for some reason you stopped wearing them for a day, 2, 3, 4, 5, 6, 7 weeks, I don't know. And I'm gonna tell you exactly what to do when you have not worn your retainer in the past little while. There's gonna be 3 things to do. Let's go. Number 1, say you put your retainer in and it hurts like heck, but you can get it in well enough. Let's say like 80% of the way there. And you have those plastic retainers, and that's why I love these plastic retainers so much more than the metal ones, because they're a little bit more forgiving and they go over the full tooth. So let's say you can get it in like 80% of the way there, but it hurts like heck. I tell patients if they can get in most of the way to wear it 24/7 for at least 3 weeks, all the time for 3 weeks. You're gonna take it out to eat, brush and floss. Other than that, it's gonna be in there all the time. And why? Because if you put it in there, the teeth are gonna slightly shift back into place, and then the next day, maybe there's gonna be slightly better, next day slightly better, next day slightly better, until a couple weeks from now, you're gonna be able to put in your retainer without any pain. But remember, the first few days are gonna hurt just like it did when you first got your braces on. So if you can fit it in majority of the way, try to put it in for 3 weeks, as much time as you can. Number 2, you try to put it in, you are nowhere close to fitting that retainer. No chance you're gonna get that retainer in. You come into your dental office or your ortho office and you get a new one. You just get a new one. If the teeth have shifted enough to not be able to put the retainer in, but not so much that you actually care, it's just a little too much for the retainer, but you don't really care about the difference, just come back in so you can get a new retainer for how your teeth are now, so that they do not shift more. Because if you just decide, hey, that's it, I'm done with my retainers, your teeth will keep shifting. And then after a few months or however long, you're gonna want to get these teeth straightened up again, and it is gonna be no chance you're gonna have to get braces again. Which leads me to my third option. If the teeth are too shifted, they're way off, and you do not like it, you cannot put that retainer back in, you gotta get braces again. Either you're getting braces or you're getting Invisalign or some version of orthodontics to make those teeth straight again. There you have it. That is the 3 things you need to do if you have not worn your retainer in a while. Number 1, try to force it in if it doesn't hurt too much and it can go in majority of the way. Number 2, if it is a little too far shifted but you do not mind it, just come in, get some new retainers. Number 3, ortho all over again. Thank you so much for watching. Dr. Nate here at Thrive Dental and Orthodontics. And leave me a question or comment below. Let me know, have you not worn your retainer for a few days in a row? I wanna know. I wanna see what you guys are thinking. And please subscribe, and I will see you guys in the next video.